Terry here with your whole health childbirth checklist video today. I prefer videos because I think everyone enjoys watching them and going through the slides with me. 17 heavy duty topics. We're going to talk about things that I feel like aren't talked about enough. So, 17 is a little bit long, but we have a lot to cover when it comes to having babies. My name is Terry Wong. I'm the director here at Whoosah Baby, and I love sharing information with people. I feel like I'm curious to hear people's responses after they learn something new or what kind of questions people will have. I work with many different groups at different capacities to advocate for improved healthcare access for everyone. And it starts with education. So, video is for new parents or parents that are having a baby in the US. This video is particularly for you. Many things that you're going to have to look out for. So let's jump into it. I realize that obviously people would like the checklist too. So download it anytime below this video to support us over here. Please subscribe, like, comment, tell us what you like, don't like. I couldn't include everything in this checklist. So I'm pretty sure people are going to be like, what about this? What about that? Let me know. I could update this checklist, but I feel like right now these are the most important things to me and what I can control. So let's jump right into it. Number one, who do you want to be there with you during this experience? While you're pregnant, who do you want around you to help you? Who do you think will be a supportive person to you? And these things also include like your doctor, because if you choose a doctor, there's a very lateral effect where this doctor works at this hospital. So you will have your baby at this hospital. That's a common rule here in New York. I don't know for other people, but it works that the hospitals have affiliations with certain doctors. So that will decide where you'll have your baby. A hospital, home, birth center. These are the three main options. And to plan for that, we'll have many different who's. Who do you want by your side? And I chose this video here because you should be choosing people that are like your friends. You want to trust them and have them there by your side, holding a particular role to support you. This support team is something that you have to build. You have to keep in touch with people and let them know how you're feeling so that they can help you. Number two, review health and history. Depending on where you are, this rule is very important. Your statistics in your area, what resources you have, is different from everyone, as you can imagine. But the main goal that I want to share with you is that the system that the healthcare was built on doesn't have you in mind, the citizen, the person receiving the care. It's definitely for the big dogs, for people who have money and don't have any problems spending it because they can afford it. But depending on your health, you might need more access to care. And I'm not pro or against hospitals, but they have services that you might need, and understand that there is a lot of challenges in accessing those services in the hospitals in America, just showing up as a different as a diverse community that needs support from a hospital system that's not so diverse. So that's how I'll explain it. And with more health issues that you know in your history and your family's history, that is a indicator for you to pay more attention to certain things. But it's not like it's set in stone. I really want you to find out as much as you can, so that we could be prepared as possible, because a lot of the same questions are going to be asked over and over again. And for your own sake, if you know the answer and the most accurate answer, then it's how people can use that information to help you. Wishes and fears, number three. I I wanted to speak about this early because it's very important to know what you personally want, from this experience, or what you foresee as a challenge or something that you fear. Let's talk about it. Um, some of the things that people mention are grounded in history or past experience, but those things should also not be ignored, right? Same as your wishes. Many people say, I don't know what I want, right? Um, and that's how learning about other birth stories helps to break down some of these fears and help you understand how you would imagine your birth and how you would want it. Each time that you gain more knowledge and experience, you're going to be like, next time this, next time that. um, because this is a learning experience, right? It's it's challenging, but it's important to lay out these wishes and fears, so that we can put them in the forefront and remember them, and remember what might be a challenge coming up ahead in order to reach our goals and our wishes. Number four, talk to a friend or doula. And this is Chuck Norris telling you, you better start talking. A lot of times I'm going to be telling you, you need to start speaking up. I I'm going to ask you hopefully really good questions that will dive deep into the areas that help me learn more about you or how you want to have this birth experience, so that I can give you the best advice based on what I know, right? Or guidance or information sharing. Everything that I share, I just hope that someone can absorb. And I say friend or doula because you just need to talk to someone. It doesn't matter how much experience that person might have with childbirth. It just needs to be a friend, someone that you can trust and talk to and tell them straight up, like, I'm really scared of this pregnancy, or I I don't know who's going to be able to help me after I have this baby. Like, these are real fears and real things that we're going to need to talk about and plan for anyway. And the main point of this checklist is this point here is to tell you that you shouldn't feel alone. Someone is around that can help you. If you talk to them and you feel like they are a friend, continue talking to them. Um, there's a lot that you could do together, and I'm always pushing for community, for more people to work together, but it's a step by step thing. You need to trust one person. Maybe that person has a connection to help you with another person or brings in someone else. These people are in your life, and I want to be the first one to ask you, please reach out to them. Don't feel any certain way and just say hi. Um, whatever it is you want to say. I'm going to be mentioning this over and over again, but practicing talking about it and talking about these things really help to manifest that it will happen, right? If you have this problem and you discuss it with someone, and hopefully you're getting ideas on how to work things out in your life and try new things, by all means, please. I'm a total advocate of trying many things because I never give up. I want something to work, right? I feel like something has to work. So to my best abilities, let's try. Medical interventions. this is also something we talk about early because depending on how little or how much medical intervention you plan to use, there are many other steps and things we have to plan for. And also for the ones that you want to avoid, there are more steps there to plan for. So it's a very curious thing, but we have to be very strategic when it comes to medical interventions because there's things called like a cascade of interventions. When one thing starts happening, you see that it connects to the next thing and it connects to the next thing. For example, um, uh, you have a close due date. So we can plan an induction date. And basically, it means if you don't have the baby by this day, you're going to very likely have a C section because you're there at the hospital trying to have the baby. And those two things are highly connected. Statistics show, and there's many examples of this. If you have uh, any sort of high risk factor mentioned, you will get start a cascade of interventions. That's the whole point of the medical interventions. But there's a lot to explore here, and it all depends on how much you plan to use. I am not for or against all or none. I'm somewhere in the middle, and you need to find out where you are. Labor prep. Um, of course, you can't talk about childbirth without talking about the pain that will come with the contractions and not knowing how long it's going to last. I love this little meme here. It's so cute, but it's serious. This is serious, and there's so many things to prepare for this one day. Uh, you could go in doing nothing at all to prepare. But there are just a few things that I would like to mention more, and I talk about it more in other videos because there's so much in childbirth. I like to break it down. But labor prep is very important, particularly if you want to try and have a vaginal birth, right? Whatever the situation is, if it's recommended, not recommended, if you've had one before, never had one before, there are certain things that a parent can do to choose to make them feel more prepared. So look out for that. Look for what works for you and practice a little bit every single day until the big day comes. Because you're going to want to practice the same things while you're in labor and feeling the contractions and um, figure out what stage you're in. Uh, I was going to give you some more examples here, but the ones that I like to talk about the most are the ones where you have someone, a partner that that will be there with you, right? What your partner can do, whether your partner is a friend, a family member, or your partner, there are so many things you can do. And the first one is touch. Touch. If touch is one of your love languages, if you love giving touch, you need to have someone around that wants to hold your hand and feels good when you hold their hand. Uh, there's so many uh, conventional and unconventional ways, kissing, nipple play. There's like straight up having sex. You could do many, many things before it's time for you to actually have your baby, right? As the cervix opens up over this time period, as your baby gets ready to come down the canal and meet us all, there's a lot of things that you can do, and don't feel like I can't do jumping jacks anymore. You can, if you feel comfortable to do it, go ahead and do it, because just because the moment you start contractions, there's a long time or many stages you have to reach until you actually push the baby out, right? I also like to talk about the positions that you're going to be in. And for me, my go-to position where I feel comfortable even before while not being pregnant is on all fours, right? In the doggy position, I don't know, the downward dog position, or where you're basically just stretching out in front of you and you have your butt in the air. Those that where you're on all fours feels comfortable for me. I feel relaxed in my core. Uh, but do what works for you, whatever you're practicing. You can do even more training on ways to manage the pain. For example, hypno birthing, or using massage. There's so many different ways. And another reminder is during this time, I want you to be super chill. I want you to move and listen to music, hold someone, hold yourself, feel, and just enjoy all the time in between contractions. Because we can't say what's going to happen. And many people will tell you, your provider might explain it this way, that when the contractions come closer, like there's a certain time stamp, but I would say anything between less than 5 minutes and it's happening for like half an hour or longer, then yeah, you are super ready to go. And later in that scale, then you're getting closer, right? So that's how using the timing of contractions can help you to realize how much longer, how much further we go in. And if you have time, I encourage you to sleep, eat, um, do whatever you want, watch a movie, something funny, whatever you want to pass this time while you are waiting for your baby to come. This you have to plan beforehand, right? For safety and your peaceful tools is what I'm asking you. You need to choose certain things and you're going to make certain decisions. And once you do, stick to them. Find out more research. Be very confident in your decision and why you want to have it, because even if you have a doula, even if you have a partner, they might not be able to express what you want. And when that day comes, if you can speak or you can write or you can tell someone, I mean business, this is how I want to have it, and I'm not changing my plans on how I want to have this baby, let's wait an hour. This is a free tip. Use it anywhere you can. I read it in a book or listened to it in a book. But someone's idea that if you could just ask to wait, this is the one sure way that you can try to extend the time while you're in a medical facility. But once you are there, this is the only tactic I know that you can use to give yourself more time and give yourself more space, because sometimes they don't give you that. They make you feel like you need to make a decision right then and there. But most of the time, just be like, I need some more time. I need some more time. I need 20 minutes to think about this and talk about this with my family. Say whatever you need to say to get this time, because you deserve it. And although that these people that you're talking to, they work on the clock at the hospital and they're just trying to wrap up everything that they're responsible for in their shifts. So um, ask for more time if you need it, review the information, and until you're actually really ready, these are ways to keep the peace, hold space for your own birth, and give everyone more time to see if this is the best situation or scenario that we have that we can work with. Number 10, plan for postpartum. This is intense. There's so many things that you need to plan for. And I would at least know who's going to help me with the baby. Let's plan at least 3 months. Let's talk about food, the costs that will incur. Um, Another plan for to do while you prepare for postpartum is to plan out your work leave. And that's part of postpartum because you might not be working for a short time or a longer time based on your employer, or if you have any limitations on how much help or how much time you have until you have to go back to work. And this is assuming you have to go back to work um, in a very short time period, when really the first year of your baby's life you are going to be exhausted and need time and need more support, particularly the first 3 months. If you're breastfeeding, if they're it's just a new situation, someone new in your home, you're getting to know the baby's going to be growing so much in these first 3 months and become more plump and less deflated alien looking baby. But it's such a beautiful time where you're just um, growing and spending time with your baby outside, right, in the same space, holding with you, but basically uh, earth side. This is a topic that some people talk about. I don't feel like it's talked about enough, where you not only become a parent, but you are becoming a big to your little. It's like becoming a mom, but it's also the dynamics of the family, um, and how it's its own challenge. But what I would like to remind you, why I put it on this checklist, is that I want you to enjoy this experience and be there for your children. I hope that you can have that time, find resources, find people to help you spend this time with your little while they are little. I push for it all the time, but obviously people have to work, and I just want you to know that work will always be there. But spending time with your little, if you enjoy doing that, please do more. Please, please just go to the park, um, take a walk, uh, do the laundry, go food shopping, things that you normally do them with your children and talk to them. Talk a lot to them. Talk to them like they are um, your coworkers or whatever makes you comfortable. Don't talk to them like they're babies. Tell them really what's going on. Talk about how you feel. These are things that might be new to you, um, but this is your relationship that you're building. So whatever you enjoy doing, start these traditions now. Talk about the same things, and very soon your little, within 2 years, is gonna start communicating things to you. So it won't be a one-way conversation for too long. Number 12, find a pediatrician. If you already have one because you have had one since your first kid, if you like them, great, keep them. But if you don't, just know that you'll be assigned someone automatically if you don't already have someone in mind. So if you would like the route of choosing someone first, like finding it based on location, please do that. Go ahead. Languages, communication, there's hours, services that they can provide at the location. Just choose many things to help you plan for who is going to help you care for your baby from basically from when they're born till they're 18. Hopefully you keep this relationship. I was lucky enough to basically have had the whole doctor my whole life, but it was, I think, assigned at the hospital. So um, if you want to choose, go ahead and look up what your coverage covers and meet more doctors, talk to more people. Um, and find someone that works for you. Number 13, comfort. Uh, this topic is important because it's not only during your childbirth, but throughout your whole perinatal period, the people who you feel comfortable around, because you're talking about very sensitive things, you, your body, how you're feeling, healing, how being a mother, like you get bombarded with things, and find your comfort place, find where you need to be, who you need around you, uh, what things that you need to feel comfortable, and have them, have those people, have these things prepared, plan for it. Pillows, there's some of these little things you can't imagine, but asking for more pillows at the hospital to make you feel comfortable, please. Like, it could be as little as that or as big as a playlist, or who's going to be there from very far away that you actually want. There's so many things to discuss there. I would love it if you guys tell me what things make you feel comfortable, or what you would plan for your comfort for your childbirth experience. Um, I think it would be different for everyone. So I'm very curious. Do you want a lot of movies or want to eat something? Um, there's limitations to what will work, but I'm very curious. Let's create a master list. What would you request to make you comfortable? Put it in the comments, message us, let us know. Again, okay, again, here we go. You better start talking. Who is going to advocate for you more than you? Um, my education course trains you to speak very confidently and know the pivotal facts that will bring you across the line to achieve your goal, hopefully. But it all depends on if you're able to start talking. A lot of people have a hard time talking because they don't feel confident, because they don't feel like they know enough. And I want to tell you that no, you could just start asking questions. You don't need to have any real particular fear or symptom. But if you want to have more information, like from your provider or from your uh, community members, right, or family, just talk to them. And hopefully, you have good people around you that will tell you, yes, you should do that. Um, you should tell somebody about that. Um, because I believe that there's a lot that can come from what you tell people. Um, it's hard to ask for help, um, but you don't have to say it in any difficult or particular way. You just need to talk to talk to more people and tell them what's going on. At the end of the day, if you feel like no one's helping you, please ask someone to put it on the record that you w- are asking for more information about your choices, and have it in writing so that it's easier for you to understand. right? Eh, There's many particular ways that you can advocate for yourself. Uh, Speaking up and asking for help is only the first step. If you even get a response, I don't even know, right? But if you never ask, we'll never know. Um, the fear of asking shouldn't prevent you from asking. In the checklist, we'll have examples of questions that you can ask, and they're very simple. Just relay them, read them as they are, and it counts as advocating for yourself, asking questions. That's my go around. Okay. If you ask more questions about something, it should indicate to your provider that you care about something, and they should continue that conversation with you. We are reaching the end. Number 15, seeking research and health equity. Early on, we talked about how the healthcare system in the US acts like a business. It also has a history of increased risks for death, for just poor health outcomes for Black and Brown people, to the extent where it is double or close to double rates just here in New York City compared to our average across the nation. For example, women are 9 times more likely to die in the hospital system here in New York City compared to around the uh, not percent, the four times likely for uh, white women. Number 15, seek research and health equity. When you start to learn a few of the statistics and numbers, you'll see that, for example, here in New York City, it is 9 times more likely for someone who's Black or Brown to have poor health outcomes compared to the nation's average, around 4. It is a big difference from 4 times to 9 times more likely. This is a percentage, okay? It's this many times. It's 90 times more likely that you're going to die in New York City for compared to the around 40 something for the nation. Those numbers are already bad. They don't need to get any worse. That's how. That's why there's a maternal health crisis, right? These numbers are showing that there's historic racism that is causing these poor health outcomes. So there needs to be changes in the health practice in America, let alone the cost issue. As a business, people should receive fair care and treatment. Number 16, what to eat. Um, this is a big topic, and this is something that people really feel like they have a say or something that they can do to improve or help the baby during this pregnancy. A parent will naturally want to think about, oh, what am I eating? Is this good for my baby? Like, and truthfully, eating more rich, healthier, uh, whole foods, as least processed as possible. For example, piece of fish, some vegetables, some grains, and call it a balanced diet. Try to have a balanced diet. Drink a lot of water, and most importantly, what you should be doing every single day, even before you plan to have a kid, is to take a prenatal vitamin. Um, the most important ingredient in the that I think is in the prenatal vitamin is folic acid. It's hard enough to get enough folic acid in our diet, particularly when we are trying to have a baby. So let's help our bodies um, use folic acid to produce the brain cells for the baby, or whatever it particularly does. But it does prove to lower birth defects. So this preventative measure of taking a prenatal vitamin is very important. It was the first work I ever did in the birth world. And it's something to me that is as simple as it's free, it's accessible to many people, but the lack of knowledge of how important it is to take the prenatal vitamin, even before you have the baby, was the target message that I was working on sharing. So I always share that, and truthfully, it doesn't matter what prenatal brand vitamin you're taking. Most of them address the folic acid need, and that is the main thing that I would check for. Last but not least, childbirth is unpredictable. And keeping in mind that, are you going with the flow? How are you responding to challenges or things that come up, or how you're feeling, how your body is responding to being pregnant? Are you going with the flow as much as possible? You might be feeling a lot of discomfort, a lot of symptoms, um, but you know that it's related to the pregnancy. And if it's normal during your time of pregnancy, then when you look back and tell your and talk about how this pregnancy was, those things will you will always remember. Right? For example, morning sickness. Some people don't experience it, and some people experience it for whichever baby that they had. So, and those are like the little things that you cannot plan for. You don't know, and I just want to remind you to continue to go with the flow, feel your body, pay attention to your body, particularly if you're still working or doing something that causes you stress, like a job or a 9 to 5. Pay attention to your body. Do you need more rest? Do you need more sleep? Please take the time during your pregnancy, because the further along you go towards childbirth and labor, you may become more tired. But this is only your body helping you to get prepared to have your baby. So whatever comes, however you may be feeling, positive, negative, just know that you're feeling it, you're feeling the flow. We acknowledge it, and I hope that you can just push it on to the more positive spaces that you have, and resources and friends and food and music, and use all the things that you have around you to feel happy and enjoy the time of childbirth and labor. uh, Speak to more people who are excited about the time that's about to come for you. If you want to talk to someone about it, what I particularly share in more of my work reflects on global health practices. What are people doing around the world when they prepare for labor? These are things that I'm interested in. I like to compare culturally, based on what resources they have. I think it's very unique to each location, and I'll share it with you. Particularly, remember, this list is for the US, but I'm pretty sure many of those things I said I wanted it to apply for. Uh, Globally, what works best and what to use to prepare. I want to give I wanted to share this list because I want you to stop questioning your abilities. I want you to show up, feel big, feel strong, and know what you know, and use what you know to advocate for yourself. Tell them, I heard about this, I learned about this. What do you think about it? Just talk about it conversationally, and you'll start to see how the people around you respond. Um, all of these things that we talk about, it depends on your own personal experiences and what you choose to learn more about. And I just want to give you these little pushes so that you do your own research. This is information that's readily available, and there are simple things you can do to show up for yourself, to respond, so that you're not just uh, letting people pass you over just because you didn't give any response at the moment, right? That's another tactic in healthcare, because there's, their time is important, and when they need a response, they need a response. But I've asked you before, ask for more time and truly make your own decisions. Don't let anyone else make it for you. And avoiding these challenges will be something that I hope more people strive to do. And as easy as it might look, to just knock away all these hard topics by Shaq over here, I want you to take Shaq's energy and just push all of these things away, because most of the time you can walk away or full stop a situation and say, I'm not ready to continue this conversation and I need to excuse myself straight up at any moment, anywhere, wherever stage you are, someone talking about you or your baby. just just excuse yourself, because some people uh, say some really ridiculous things, and I just don't want you to respond. I don't want you to be reactive to it. I want you to just knock all these things out. They ain't bothering you. Again, go with the flow. And as you continue your journey of childbirth in America, I hope that you are informed, meaning educated. You're equipped with some information so that you can have the birth that you imagine most. You won't be surprised by how things work in the US healthcare system after you've taken a class with me, because I will tell you straight up, will it be a problem? Is there a financial benefit for someone? Uh, yes and no, and just go with the flow. What can you really do? At what stage? What can you really do? Let's see. Let's see what choices you have, and continue to go with the flow. I love working with families. I hope that everything that I do helps the maternal child health community, and I'll be sharing more in future videos about who I am, what kind of work that I do, why do I do it, what's my goal, what's my intention, and other than improving healthcare one mama, one parent at a time, um, I do this work for people who are parents. I I believe that when I am a parent, or when I choose to become a parent, I will have this education, this information. It's like nobody told you you need to go to school to be a parent. If there was a school, I'd go to it, right? Because I want to be a better parent. And adding more adding more information about what you know about the birth experience really does shape the future of your your experience with healthcare in general. So although this is a particular group of people that I'm working with, which is parents, a lot of these things actually apply to a lot of people, because of the way the healthcare system is designed as a business. So it's very obvious here in birth work, and just know that you are gaining the core knowledge and skills because you are advocating for yourself. And this course is valued at $550. I put a lot of work into it. I beefed it up, and I'm always adding to it. As the years go on and healthcare system changes, I want to give back to my community, and I am a community birth worker too. So I offer scholarships for people who have families or have parents that they believe would highly benefit from this course, but may not be able to afford it. I also have a sliding scale, but this scholarship is available to a lot of families. There's very minimal requirements, and I just hope that more people access the information. So please share this with anyone that you think would benefit from a full course that covers all the things that we talked about today and more to help families prepare for childbirth. And I have so much more to share with everyone coming up. Look out for me this year. You'll see that I'll be talking to you again soon. And thank you so much. Hear from everyone at Whoosah, baby.